Welcome to today's lecture on principles of serological diagnosis. In this comprehensive script, we will delve into the fascinating world of serological testing, exploring its fundamental principles, various techniques, and their applications in diagnosing a range of infectious and autoimmune diseases. So, let's begin our journey into the intricate realm of serological diagnosis. Serological diagnosis in infectious diseases relies on antigen-antibody interactions. Antigens elicit an immune response, while antibodies are produced in response to antigens. Specificity refers to the selective binding of antibodies to particular antigens, allowing for identification of pathogens or disease markers. Sensitivity refers to the ability of serological tests to detect even small amounts of antibodies or antigens. Different tests use various techniques depending on the disease being investigated. In serological testing, antibodies or immunoglobulins play a vital role. Antibodies are produced initially during an infection, while Ig antibodies provide long-lasting immunity. Different antibody types, like IgA, IgD, and IgA, have distinct functions in the immune response. An accurate interpretation of serological test results requires a comprehensive understanding of antibody structure and function. Immunofluorescence, ELISA, and Western blotting are important serological techniques used in diagnosing infections. These techniques involve labeling antibodies or antigens to detect specific pathogens or disease markers, quantify antibodies or antigens, and confirm the presence of specific proteins, respectively. Agglutination reactions, which involve clustering of antigens or antibodies, aid in the detection of infections. These tests, like the Vidal and RPR tests, are important in diagnosing diseases accurately. Understanding their mechanisms and applications is crucial for interpreting results. The complement fixation test is a complex serological technique based on the principle that specific antibodies, when present, can fix or consume complement proteins. The absence of hemolytic activity in this test indicates the presence of specific antibodies. This test has been widely used in the diagnosis of various infectious diseases, including brucellosis and viral infections. Understanding its principles and interpretation aids in confirming specific antibody presence and the diagnosis of relevant diseases. Neutralization assays measure the ability of antibodies to neutralize the infectivity of a virus, preventing it from entering or damaging host cells. These assays are crucial for the diagnosis and assessment of viral infections, such as influenza or dengue fever. Understanding the principles of neutralization assays is essential for accurately interpreting test results and guiding clinical decisions. Serological panels and profiles consist of a combination of tests aimed at detecting multiple antibodies or antigens related to a specific disease. By analyzing the presence and levels of various antibodies or antigens over time, the infection stage and progression can be determined. These panels and profiles are particularly useful in monitoring chronic infections like HIV, hepatitis B, or syphilis. A comprehensive understanding of the principles and interpretation of serological panels helps clinicians manage these diseases more effectively. Cross-reactivity refers to the ability of antibodies or antigens to react with substances that are structurally similar but not identical to the target antigen or antibody. This phenomenon can lead to false positive or false negative results in serological testing. Understanding cross-reactivity and its implications is vital for accurately interpreting test results, avoiding misdiagnosis, and ensuring the diagnostic accuracy of serological tests. Serological markers, including seroconversion, rapid antibody tests, and disease-associated antibodies, are essential tools in diagnosing and monitoring infections. Rapid tests provide fast results, while disease-associated antibodies help differentiate different conditions. Chronic infections, such as HIV, hepatitis B, or syphilis, pose challenges in serological diagnosis due to the complex immune responses involved. Serological tests play a vital role in the diagnosis and management of these infections. Understanding the specific challenges faced in detecting and interpreting serological markers for chronic infections ensures accurate diagnosis and appropriate patient care. Serological testing plays a crucial role in diagnosing and monitoring autoimmune diseases. Rheumatoid arthritis, systemic lupus erythematosus, SLE, and autoimmune hepatitis are commonly diagnosed through the detection of specific autoantibodies. Identifying these disease-specific antibodies through serological tests aids in early diagnosis, classification, and monitoring of disease progression, leading to better patient outcomes. Advancements in technology have led to the emergence of new techniques in serological diagnosis. Microarray technologies allow simultaneous testing of multiple antibodies or antigens in a high-throughput manner, enabling rapid and accurate diagnosis. Protein-based assays, such as multiplex bead assays, provide valuable insights into the antibody profiles of patients, aiding in the diagnosis and monitoring of various diseases. Next-generation sequencing has the potential to revolutionize serological diagnosis by enabling the identification of novel disease markers and providing detailed information about the immune response. In conclusion, serological diagnosis is essential in medical microbiology. It involves understanding antigen-antibody reactions, antibody function, serological techniques, and their applications in diagnosing infections and autoimmune diseases. Serological testing plays a critical role in chronic infections, autoimmune diseases, and emerging techniques. It provides valuable insights into the immune response and aids in disease diagnosis, treatment, and prevention.